Well, welcome everyone. It's our great pleasure today to welcome you to what is our last official talk before spring break. And I really just want to say a note of thank you to all of you who are joining, because I do know that it has been an exhausting first part of the semester for multiple reasons, and we really appreciate your being with us today, especially because I am so extremely excited to be able to introduce to you our speaker for today in our series. We have today with us Professor Sanjoy Bhattacharya, who needs no introduction, but I'll try to do a very, very quick job in terms of introducing him as co-director of the History Department Center for Global Health Histories and professor in the history of medicine, a Wellcome Trust Senior Investigator, and the head of the WHO Collaborating Center for Global Health Histories at the University of York. Sanjoy specializes in the health, medical, political, and social history of 19th and 20th century South Asia, as well as the history and contemporary workings of international and global health organizations and their programs around the world. And in this context, he will be speaking today and has written extensively, in some ways, the definitive monograph about the eradication of smallpox and the involvement of the WHO and the CDC in South Asia, with a particular focus on India. Many of us, and especially in these seminars, speak about interdisciplinarity, and Sanjoy has really inhabited this interdisciplinarity for a number of decades now. He's a co-founder of the WHO's Global Health Histories project, which works across its headquarters in Geneva, as well as regional offices and country offices across the world. He has spent a lot of time in WHO archives. He's audited WHO activity, and he carries out research to assist policy initiatives and public engagement at WHO member state level, in addition to organizing a regular roster of seminars and workshops. And this is work that has been carried out over multiple years, over 2 decades. And in addition, Professor Bhattacharya, or Sanjoy, he has explicitly said he prefers to be called on a first name basis, co-edits with Dr. Niels Brimnes at R Hopkins, who has also written about smallpox in India, mostly in the 19th and 20th century, actually, and Dr. Nitin Sinha. He edits the New Perspectives in South Asian History, which is an established series of monographs published by Orient Black Swan since 2001, and also edits Global Health Histories, the monograph series, since October 2013. But he's here today, and thank you so much, Sanjoy, for taking time out to speak to us really about what has been an important focus of his research, in which many of us here have learned so much from, which is smallpox eradication, and the subtitle, which I think is provocative, and I very much look forward to the talk, a racially inclusive history. So without any further ado, Sanjoy, I turn it over to you to speak for between 30 to 40 minutes. And thank you so much for being here with us today.
Thank you so much, Prerna, for the invitation. And it's good to see friends online as well. And heard wonderful things about you, your work from Nitsan, who I see is online. So hi, Nitsan. Without further ado, because I don't have much time and I have quite a few slides, this is a bit of shameless self-publicity. This is the book that I published in 2006 with then Orion Longman. It's now called Orion Black Swan, based in Hyderabad, India, my beautiful, absolutely wonderful Indian publishers. A lot of people told me I was committing career suicide by publishing in a non-university press in India when I sent this manuscript in. But I had a reason for doing this, because I wanted to engage Indian audiences. I wanted the book to be accessible to students and universities in India. And I think that happened. And because that happened, a lot of people who had been directly or indirectly associated to the smallpox eradication program in India saw the book, read the book, and then got in touch with me. So it was their material that they then generously shared with me that has continued what I'm going to talk about today. I mean, some friends have asked me, how can you work on a topic for so long? I have been working on this topic for a long time, but I've also changed the way I look at the topic. So I've become my own biggest sort of critic in a sense. I'm developing the way I study things, what I study, and how I study stuff. So what I'm presenting to you today is the gold dust that I highlight in the slide. That is all the material that the many smallpox workers from India who contacted me and gave me the papers, that this is sort of a homage to them. Now, as I started looking at material that was shared with me by these Indian smallpox workers who had worked in different states, different districts, what was very clear to me, because I had spent a lot of time in the WHO archives, and I'm grateful both to the WHO and the Wellcome Trust, one for allowing me access to an archive that no one had seen in such detail before. I had complete access, no blockages of any kind. And the Wellcome Trust grant allowed me to stay in a very expensive city, that is Geneva, for a long time. And of course, then I was very lucky to have a maternal aunt and her husband, my uncle, who very generously let me stay in their house in Geneva when my grant ran out, because this archive was just so enormous. It became very quickly apparent to me that what smallpox workers from India were giving me was much more than what was available in the archives, because the archives in Geneva don't really give you a fulsome view of the correspondence between people on the ground who are managing the program day to day and their sort of national and international managers or collaborators who were mainly based in the WHO Southeast Asia regional office. And then only some of these reports would be forwarded to WHO headquarters. So at the very outset, I want to highlight to you the fact that there are a lot of subjectivities involved here that you should be aware of. The subjectivities within the New Delhi office of WHO about what is important, what should be shared with Geneva, but also often acts of translation where some bits of reports are considered more important than others and translated into English or other UN languages and sent to Geneva, and other bits not. So often what you read in WHO headquarters is necessarily an abridged version, abridged by layers of subjectivity. So if I hadn't got access to papers that the smallpox workers from India had given me, I wouldn't have really understood their fuller views on the issues that I was studying. And that is something I came to realize more and more and more after Expunging Variola was published. So I think it's a good mark. There's nothing wrong in us academics saying that, we miss certain things, could have done certain things better. And I'm very fortunate that I have a job that allows me a second and a third and a fourth go in trying to better what I did in 2006. But there was pushback too. And I'm going to be very frank today. And, there might be some who, might have links with institutions I'm talking about, and I welcome discussions with them. I would warn anyone, I'm not easy to terrify. So, I've had a lot of CDC, ex-CDC officials try to come at me. They don't scare me. It just makes me more determined to find stuff in the archives that challenge their subjective perspective of what they think happened in the Indian smallpox eradication program. So all for friendly debate, discussion. Very happy to meet you over a meal. As long as we work together to try and make more democratic histories available to everyone, I've got your back. I'm there to collaborate with you. So there was pushback from the US CDC to my book, Expunging Variola. And they had several concerns, the ones who got in touch, which also highlights something I'll suggest to all of you later on, that there's variation within the CDC, US CDC as well towards this issue. They were concerned, for instance, that I hadn't given sufficient attention to the CDC's very active role in the Western Central African campaign, smallpox eradication campaign that happened in the mid-1960s. And they kept pointing to this book that I've highlighted, which, you know, my eyebrows sort of rose so much that they almost traveled out of my face when I saw the title of this book. But you know, this is the book they felt I hadn't read to educate myself sufficiently to write Expunging Variola. But the point was that when I was looking at the India files, either in Geneva or through personal papers, many of the issues that were being raised in this particular book, CDC and the Smallpox Crusade, seemed completely unimportant to the people I was studying. So that got me thinking about the history-making process, power, racial superiority, supremacism, how one race thinks what people of other races are unimportant, even when about 100 people from the CDC working in India at any point of time were outnumbered by hundreds of thousands of brown actors from India. So the idea that if I, you know, somehow the views of thousands of Indians is less important than hundreds of largely white Americans is more important seemed absolutely bizarre to me. And the more I've interacted with less democratic elements of those who seek to remember the CDC and smallpox eradication, the more amazed I am at the self-confidence, but also the complete lack of shame that is required to make some of these comments. But there were others who had had links with US CDC who were more internationalist, who were more democratic, and I like to call them the CDC internationalists. And a very good example of that is Donald A. Henderson, who I think played an immense role, but it's his internationalism that got him into trouble with the US CDC, even before smallpox eradication had finished and he left the WHO, not to rejoin the CDC, but to take over the Dean of Public Health at Johns Hopkins University. But for me, I started getting emails, people, I would meet people and they would seek to re-educate me. And a good example of these concerns came out in Donald R. Hopkins' book review in the Journal of American Medical Association of my book, Expunging Variola, in 2007. I've given you further details there. And of course, he was, you know, a very eminent public health official, also unusual that in that he was African-American. This is, you know, a much more racially complex engagement between me and the reviewer. But he was a powerful man. He was in the Carter Center. He's still involved in guinea worm eradication efforts, as far as I understand. But he had views about what I had missed out, and what I had missed out was insufficiently mentioned the CDC African program. And I had also, in his view, not really referred to William Figi, who'd been active in India off and on between 73 and 74. Now, what I had been very aware of through my very detailed study of the archives in Geneva and the private papers that have been given by multiple officials, was that US CDC officials were not really involved in India. They were only fleetingly involved. Yes, they'd go to district here, state there. They wouldn't spend any meaningful amount of time I mean, this was an international bureaucracy in a sense, moving around, training, but also learning. A lot of noise made about the training. I wish as much noise was made about the learning on the ground. And perhaps if someone's listening in, they'll take the message back that, humility and learning and reporting of humility and learning has much more long-term impact policy-wise than self-centered, artificial, memory-based shouting, which can be quite off-putting for Asian and African public health thinkers and officials, especially in the 21st century. The world has changed, and perhaps that is a prompt for us to also change the way we do our histories institutionally. What I'd like to point out to all of you is that in a Cold War scenario where India had fought multiple wars with Pakistan and the United States had supported Pakistan in those conflicts, it was actually very difficult for US officials to get into India in the 60s and 70s as US citizens, as US passport holders. How the US CDC officials got into India is testament to the very great importance of the World Health Organization. Without the World Health Organization's secondment of these officials into India, they would not have been able to even enter India and work with it. All international workers were vetted by India's central government's External Affairs Ministry and Home Ministry. And therefore, I say this in a considered way, the WHO was exceptionally important in enabling international workers to work across Cold War tensions and boundaries. And it is in this context that I think the WHO should be seen as a civilizing salve, at least for some international workers, because apart from letting them into India, they would sometimes also offer a list of what would be considered good manners. And Donald A. Henderson actually played a very, very important role in this, because he had this knack of yes, he could be a fierce negotiator when needed, but he had this knack of listening. He had this knack of respecting others. Yeah, simple message, he treated others as he liked to be treated, often forgotten in some global health circles or international health circles. So as a historian who wants to make a change, who wants to stoke conversations in policy circles, I think it has been very important for me not to overgeneralize about anything. Highlight the fact that the world generally is, wondrously diverse, and we need to study the world in that diversity. So there were some CDC officials, who I would call international and autocratic. And then there would be some CDC officials who would be more democratic. And those two attitudes came together in India, where there were also a variety of perspectives, attitudes towards international workers, nationalism, how, overseas views about how overseas people should behave, and variations in political access and power too. So there were certainly some Indian officials working in contexts where they had access to massive political power. And if a US CDC official or any international official was considered to be misbehaving or being too disrespectful, these people had the power to throw them out of India. So we have to remember that as well. It wasn't as if people could just fly in from Atlanta or New York, land in Delhi airport, take a taxi and go wherever they wanted. So a lot of negotiation involved. So soon after Don Hopkins' JAMA review came out, and this is, I think, the first time I'm showing this in a public presentation. I think the day after the review, or so very soon after the review, I woke up to an email from D.A. Henderson. And this is what D.A. Henderson had to write. I'll just leave, it's a long quote, just read the highlighted bit. And I have to say, having read that review and also having by that time sort of engaged, having had pushback from some actors within your CDC, I had to agree with DA when he said, I hate to say, but there is an egocentric quality to CDC that can be objectionable. Some of what was being said was objectionable, in my view. But it's this bit of his very, very long, thoughtful message to me, which he didn't have to send me. I hadn't asked for it. Again, shows you the quality, the democratic quality of this man. He told me something I was aware of, was writing Expunging Variola, but perhaps I had not pushed sufficiently. And so, again, today's talk, the work I've been doing more recently, is dedicated to DA, because if he hadn't sent me this message, what I sort of knew and was quite aware of was confirmed, and basically this gave me new leads. And so whenever Indian officials would get back in touch with me, because many of them read this review and were horrified by it, we then started talking in a very focused way about the Indian pilot programs of the 1960s, some of which predated the US CDC work in Western and Central Africa. And some of it actually was happening at the same time. And this is what DA was telling me, that there were surprising findings about how to control smallpox coming out from India as well, including a practice known as containment and surveillance and containment and immunization, which certain CDC officials would like to believe they discovered in Nigeria, and it was their blueprint for the world that made smallpox eradication possible, with Bill Figi being at the center of it all. What DA was telling me and what I was seeing in the archives and what I was finding out from the private papers of Indian officials who had got in touch with me was that similar findings were already being made in India. And the more important point that the Indian workers were telling me about was the reason many of them agreed to expand the idea of containment and surveillance was not because a bunch of Americans or American officials claim to have found this miracle way of working in Western Central Africa, but because people whose judgment and work they trusted in India were saying similar things. So again, I think we need to think very, very carefully about what prompted workers in countries like India, where there was a lot of self-confidence about abilities. Smallpox was considered a big problem. Immunization structures were quite comprehensive. There was fear of smallpox. And therefore, smallpox immunization work and control work was around. So what causes policy shifts, I think, needs more thinking. And I think DA's last line here, that the CDC myth about surveillance containment has been so often elaborated upon that has become a cited fact on some occasions, is completely true. We need to question some of these assumptions that too many policy actors have spread without being questioned, and then too many academics who either want to be very close to these powerful people and therefore just parrot their views, or don't have a spine, which is also a problem, but a very real problem in academia, cause such myths to be disseminated, often without question. Now, rather than being too negative, I just want to point out that the democratic internationalism that D.A. Henderson showed, everything he did, every time I met him, and I met him many times, in a variety of settings. It wasn't all about my book or research. We sort of thought deeply about polio eradication as well. The D.A. Henderson was not the only Democrat. I mean, there were many others. I'm not trying to say that, there's a group of American autocrats and there's this one group of American wonderful international Democrats who then make everyone democratic. I'm not saying that. What I'm saying is that the international Democrats were truly international. There were people from all over the country who were not consciously racist, but they were aware of multiple complexities, aware of multiple political, social, cultural determinants. They wanted to study issues surrounding these challenges and then bring them into the planning of smallpox eradication campaigns. And one very important figure who I'd like to highlight here is Isao Arita. He was for a long time known as Japan's living treasure. I think he's passed on, sadly. Wasn't very well a few years ago. But he was Henderson's deputy and in fact became the director of the smallpox eradication in Geneva when Henderson left for Johns Hopkins University to take over as dean. And indeed, he was the person who was director of smallpox eradication at WHO headquarters when smallpox eradication is actually certified. And yet not many people talk about him, which is, at least from my perspective, that's seen in relation to US CDC in extremely bad taste, shows that, they have a problem about accepting non-Americans as equals, even someone as eminent, someone as hardworking, someone as well-regarded as Isao Arita. You won't hear his name being spoken too many times. But he was by no means a marginal figure in smallpox eradication. And there's also the silence in academia, especially in writings about smallpox eradication and CDC, published in America, written by American scholars, and which is, again, the point I'm trying to make, that it's sad when historians get trapped into one subjective way of seeing the world, lack of criticality, worries me sometimes, especially when scholars clearly claim to be radical, claim to want to transform this world into a better world. But even then, even in their critique of what they think is bad, America never seems to leave the center stage, and that's deeply worrying for me, because if you want to study India in its own terms. Don't study, India in terms of what the CIA or the FBI or whoever, whatever organization was involved in talking to Indian actors, things about India. I mean, that basic understanding of subjectivity seems to escape some of this academic writing, which is sad. So I just want to, the recording has started again. Excellent. So what I wanted to point out to all of you, especially the young ones out there who represent the futures of our subjects, health policy, that there were significant groups of people who felt that democratic, inclusive internationalism was not uncool. So democracy existed. We just have to find means of studying them and reporting on them. And here is a picture of my heroine of smallpox eradication. If you want me to identify one person who I think was amazing, it was her, Nicole Grassi, Swiss-French, took no prisoners. I think that many in the Indian government feared her, spoke to her extremely respectfully, dealt with her very respectfully. If they wanted to stop her from being effective, they would just not reply to her telegrams or letters. I mean, they were just terrified of her. But even US CDC officials who had a reputation for throwing the weight around were careful of her. So, you know, this was a lady, a wonderful smallpox worker who evoked fear amongst those who wanted to be bullies or didn't want to listen or didn't want to be respectful. So for me, you know, wonderful person. And yet, she was also a fearless critic of D.A. Henderson. And reading correspondence between D.A. Henderson and Nicole Grassi during the smallpox eradication program, the 60s and 70s, really was a pleasure to see. It taught me a lot about management too, how DA would take criticism positively and use it effectively in the formulation of policy. But Grassi's really important role comes in creating trusting, deep, effective relationships with a range of Indian actors who tend to get whitewashed out of US CDC histories. I mean, you know, even the Emory Oral Archives, which I quickly talk about later, you know, one Indian chap gets mentioned, Mahendra Datta, a very important gentleman, don't get me wrong, but he was possibly the one who had the best relations with Bill Figge. So if you're now going to record history and we're now going to identify, you know, histories of a major global program on the basis of people's friendships with one US official, then we have a problem. So I'm trying to highlight the fact that we need to democratize our perspective and study as many people as possible. So the other things I was involved in when I became aware of the variety of internationalisms that existed was, you know, when I worked on this book, and this book came out of some activities at University College London, where I used to have a tenured post, which I resigned from in 2010 to come to York. We invited a lot of these actors to speak about smallpox eradication. I interviewed them separately. We also had a lot of discussions over meals. And so, you know, learned a lot over that time. I was also contacted by CDC, his ex-director, David Senso, who was a delightful democratic man, who invited me to go to Atlanta to talk and engage to CDC officials about smallpox eradication. You know, largely failed effort at re-education. I just came back with some of the views I had that, you know, were bothering me, some of my suspicions that were sort of underlined during that trip. I also saw a variety of internationalisms, good and bad, during the celebration of the 30th anniversary of smallpox eradication, which was held in Fiocruz in Rio de Janeiro in 2010, when one group of UCDC officials really didn't want Brazilian officials to be felicitated for their role in the international program. But then, you know, the Brazilian government luckily stood its ground. That was the age of Lula, not of Bolsonaro. And the felicitations happened, and a very interesting gentleman, Dr. Ciro de Codros, who I would, you know, recommend for study, because, you know, he was a healing diplomatic balm between all sides. So what I'm trying to say to you today is that the smallpox eradication program, and it doesn't matter whether you're looking at it from what you define as a global perspective, what you define as an international perspective, what you define as a regional perspective, because these are not self-explanatory terms. But these terms existed and they were defined in a multiplicity of ways. So the whole thing is a wondrous mosaic, I would propose to all of you. And it is here that I want to provoke some of you even more. Some of you will agree with me, some of you will get provoked. If you get provoked, I'm not trying to insult you, I'm just trying to make you think in another way. And you can agree with me, disagree with me, it doesn't matter, we can still be friends. Never forget, something doesn't have to be international if the US is not involved. That is, the involvement of the US doesn't make something international. India and Sri Lanka working together is international too. Always was, always will be. That humility, I think, both in academic and policy circles would help a lot, help promote democracy. In relation to the history of smallpox eradication, I'd just like to highlight, for example, that Sweden and the USSR played a crucial role. I mean, USSR provided hundreds of millions of free doses of the freeze-dried smallpox vaccine. Something worth remembering at a time where there's so much vaccine inequity during COVID. And some of that was given through bilateral agreements, and some of it was given through the WHO. Again, the WHO's important role comes up as a redistributor, free of charge of vaccines to poor countries all over the world. Sweden provided the hundreds of millions of krona, which were absolutely crucial in the 1970s. Without that, there would have been no worldwide smallpox eradication program. And sadly, the Swedish government itself seems to have forgotten its own important role, which raises another point about self-confidence, the value some of these political structures give to history or social sciences, and how they lose out by not giving it the importance that these disciplines deserve. So if the smallpox eradication team is a complex, or program is a complex mosaic composed of many pieces, I would argue to you that each piece had numerous networks and actors in play, and that we need to study all of them to create a racially inclusive and democratic history. So, in this regard, it's important. I use this picture in a considered way. So in the structure that I am proposing to you, submitting to all of you, the gent in this picture who's holding up a smallpox recognition card is possibly more important, in my perspective, than any CDC official who ever served in India or Bangladesh. This is a photo from Bangladesh from the WHO archives. So what I'm arguing against today is not just bad manners of some policy actors at the time or now about how they remember the past, but I'm also trying to suggest that we have to be self-aware, humble, and less elitist in order to be able to do more democratic history. And inclusion, which I define as good manners and a moral compass, is not that difficult. I think all faiths in this wonderful world that we live in accept that, we should really behave with others the way we want to be treated. There's different ways of putting it, but, it's all there. So just requesting all of you to consider that even when you do your social science and humanities research. Who are you studying? How are you studying them? How do you treat them as humans? Or do you see different types of human beings? And if you do see different types of human beings and different capabilities, and you're accidentally falling into a civilizational pothole, why is that happening? Do you need to rewire your mind into more democratic ways? Academia allows that, and why not use it? So, avoiding non-civilizational, non-paternalistic, non-racist worldview, I would argue to all of you, is actually quite good for one's health, but also good for creating a better world. So for me, let me give you very quickly before I wrap up, a different time frame from the CDC time frame. I would argue The smallpox eradication program had a first phase in 1948 to 58, which was exceptionally important because that saw decolonization of European empires, that saw the independence of India, Pakistan, Burma, and Sri Lanka, and Indonesia. And all these countries came together to make sure that the WHO was not another version of the Interworld League of Nations health section. It was something much more. It was something more democratic. Regionalization for me was not a problem. WHO's regional offices were a mark of the democratization, that attempt to democratize in post-war international health. So from that perspective, if you agree with me on that and you start looking at the issue of smallpox eradication from the region upwards, then you quickly realize that actually people are banging on about smallpox and the need to eradicate it right from 1948. The issue really didn't need US CDC to get involved. I mean, history didn't start with US CDC. There was a longer history involving many non-white people from many countries that are worth studying. So I would suggest to you that 1948 to 58 is very important first phase. But then I would actually say that, you know, that period that the US CDC history bangs on about, the mid-1960s to sort of the late 1970s, would not have been possible if what happened in 1958 and 68 didn't happen. And that's where Viktor Zhdanov of the Soviet Vice Minister of Health makes a call for smallpox eradication. And importantly, the World Health Assembly accepts that in 59 after a majority vote. Democracy matters. Looking at the debates before that vote is fascinating. It shows you who's opposing, who's supporting. Something new was happening in international health that was being enabled by the WHO as a democratizing force. And this is why I think we need to keep fighting for the WHO. The WHO is a force for good. That pesky one country, one vote thing can sometimes be useful. You know, global funders sometimes say, oh, that's very inefficient. Yeah, it's inefficient because it doesn't let them do what they want to get done. But it's a very powerful way of making sure that there are some protections against unfettered state power, or now a bigger danger, non-state power. So it is in this context that those Indian pilot programs that I spoke to you about earlier in the 1960s become very important, at least for India. And without India, there would have been no global smallpox eradication because India had so many smallpox cases. So we could even consider the Indian smallpox pilot programs, even though they didn't involve any US CDC officials, as a very important compass for the Southeast Asia regional office of the WHO, and therefore for the WHO headquarters, and therefore for worldwide smallpox eradication. So that's why I've highlighted this in bigger, bolder alphabets and yellow color. But we should never forget the Indian officials, and you can put Pakistani there, you can do Bangladeshi there, you can do Burmese there, you can do Ceylonese or Sri Lankan there, it doesn't matter. These officials could think and act independently and contributed to the move to the so-called intensification. They provided the epidemiological basis for the move to intensification. The intensified smallpox eradication phase didn't happen because a small group of US CDC officials made a lot of noise. I mean, they could make a lot of noise, believe me, you know, as if, you know, we are the world sort of nonsense. But it didn't happen because of that noise. It happened because of evidence, and that evidence came from this very important 10 years. Okay, why? Yeah. And then we have a third phase, 68 to 1980, when intensification happens, and not just because of the lessons learned from the US CDC program in Western Central Africa. A lot of things are happening in South Asia and Southeast Asia and West Asia, which are coming together, where lessons are being learned. The program is being constantly adapted in a variety of localities. And it is here where a lot of US actors who are not connected to the CDC also make a contribution. So people like Larry Brilliant or Steinglass, or indeed Amaral from Brazil and Tarantola from France. These are all very, very important figures. Isao Arita is exceptionally important here and later in the Horn of Africa, alongside De Quadros and Amaral from Brazil. I'm running out of time, but I have so many lovely stories about Amaral. He got kidnapped by a rebel group while he was working in the Horn of Africa. And of course, Isao Arita was getting very worried. His family was worried. Amaral's family was worried. Isao wanted him. Isao Sensei wanted him. Irati Sensei wanted him to be released. And then, the fee was paid and Amaral was released. But before he got released, Amaral convinced the entire rebel army to get vaccinated. It takes skill to do that sort of stuff. And we shouldn't forget such colorful, important figures who are willing to be kind and care about people who are, imprisoning you. So why make an effort to be racially inclusive? So I would argue to you very quickly, this allows the production of more policy relevant histories that better prepare high-income country actors in contemporary work in today's projects. A reminder to them, such history can be a reminder to them to view low and middle-income countries respectfully, their officials respectfully, as thinking able equals, not some sort of, mimic in training, or, just because they speak English with an accent, they're somehow fools. Always important to remember that they speak English better than any language that many global actors can speak that are of relevance to areas where they go to. So, just as an act of humility, and that humility, I hope, history that stokes humility could help actors view communities more humanely, not as monolithic blobs of colored people to be sneered at or pitied, but, people they could learn from, people they could be nice to, who, when they're nice back, could be actually a rather pleasurable experience, not a white man's burden. And I use the term here in considered ways. If we do all that, I think we can have an international and global health world where the work is done not to buttress high-income country CVs. And presently, high-income country CVs are not just of white men. And I think people like me who are brown and in a high-income country have to be very self-aware of not misusing, not monopolizing spaces that movements like Decolonize Global Health are providing to sort of take those spaces and elbow out low and middle income country people who, A, really need to be there, and B, can actually teach global health actors much more than I could, perhaps, certainly. So if we do this kind of history, which stokes humility, which makes us better people, then I think we would avoid trying to do, or we would lessen the ambition to do things to promote certain careers and actually focus on the welfare of the many, which I think it has to be our primary goal. And it is here that I would just want to highlight that there are continuing forces of racial exclusion in history making through history. Emory's CDC's sort of oral history repository is a very good example of that. There are other online archives also developing which have damaging subjectivities where, very small number of white actors are being presented as a repository of history of what happened. And that bothers me very greatly. So, I can't help but notice that hardly any female, non-US, non-white voices are recorded in many of these supposed global sort of programs, which is shameful, really. For me, this is a devaluation of these people, and therefore, this disinterest is not accidental. This is not unconscious bias. This is very, very conscious bias. I'd like to end with another reminder. Not so long ago, I had an email inviting me to be part of a Harvard program where some ex-US CDC officials, Bill Feige mainly, seem to have found a lot of money to organize, Harvard Business School style teaching cases, open access and all that, teaching cases to introduce students, practitioners, policymakers to detailed on the ground real world experiences in global health delivery. We are now working with Becoming Better Ancestors project, including Bill Feige and others, to write a teaching case documenting the eradication of smallpox in India. When I read this email, luckily my mouth was pointing away from the screen because I spat my coffee out, because if this is the way of writing histories of India and writing histories of how things were done, what hope is there for the future of global health? It took, I think, special kind of self-awareness for, and I'm not naming the person in Harvard, to write to me because they wanted me to help them. It wasn't clear how they were going to use my help, but they wanted me to help them. So I've also become very aware of not becoming the only brown face in a room full of whites to, justify programs as well. So I did not accept this kind of invitation. And for me, history as the recorded memories of a small number of well-resourced individuals is very difficult to stomach. But I want to end on a positive note. I value white allies. I value Democrats. I value Democrats of all races. So I do believe more racial inclusion is possible and desirable, and I'm happy to work with Democrats all over the world, whatever race, religion, gender, you may be, as long as we can work together to promote democratic perspectives, either in relation to smallpox eradication or any aspect of international global health. Please contact me. I'd love to work with you. Thank you.
Thank you so much, Sanjoy, for that, provocative and sweeping, but I think, I always kind of, really relish talks that have an argument, and this talk has an argument, a message, lesson, a warning, all kind of in one, and I kind of really, I think all of us here appreciate that. So what we're going to do now for hopefully the next 15 to 20 minutes is that so far you've had your videos and your audios. Just for logistical reasons, unfortunately you haven't had access to them, so I will request Grace to allow you to kind of turn on your video if you would so like, and also to be able to unmute yourself, and hopefully be able to engage Sanjoy in this discussion. And while you're doing that and collecting your thoughts, I thought I would just start off by just kind of talking about two things. One is where the CDC and the WHO look extremely different today. So viruses are not new, pandemics are not new in many ways. This is, for many of us, our first experience with one. But these institutions that you have spoken about look quite different today than they did in the 1950s and 60s and even the 70s. And so I wonder now, the CDC clearly does not have the kind of either ambition or perhaps capacity to do anything like what it was doing. And, Nitsan's in the room, and the WHO has also kind of changed. So I guess my first kind of, it's not so much a question, is to ask you to reflect a little bit about what does it mean to have racially inclusive histories when, as you yourself pointed out, Sweden doesn't have that kind of. So in a way, there's the absence of any kind of an internationalist in the way that you have kind of, I think very helpfully defined or redefined internationalist. How do we do this when these institutions look very different today as they did in the 50s, 60s, and 70s? And secondly, part of this question of whitewashing, which I think is really important, is both. So the one aspect of it that you mentioned was the undermining and the kind of lack of recognition, humility, and also then of, you know, of a recording in terms of the preservation and of the history of Indigenous voices and contributions. The second part of it, which is kind of related to some of the work I've been doing, is the use of coercion within these eradication campaigns, which I think is of relevant today as we kind of encounter hesitancy around another vaccine. And so what does it mean to write histories? And are there many, you know, I don't like this whole like lessons from smallpox for today necessarily, but is there a way in which, you know, what does that mean for today? And is there a kind of whitewashing of a different sort within the archives as well, perhaps, which is not just kind of undermining the contribution of Indigenous actors, but just undermining or neglecting to mention what white actors in perhaps with Indigenous allies might have done in terms of the non-democratic aspects of that campaign? But please raise your virtual hands as Sanjoy begins to respond, or feel free to put your question in the chat. And I hope to be able to have some more voices other than mine join us in this discussion. But Sanjoy, if you want to start us off.
Yeah, so thank you. I mean, two very important questions. So one thing people forget, I often used to forget, I don't forget anymore, is how recent smallpox eradication was. So the work, attitudes, memories of actors who were involved in the last phase of smallpox eradication, let's say from 68 to 1980, are now getting lost to all of us because, you know, sadly, many of these actors are passing on, and their views haven't been recorded in many cases. But those views, or not just those views, the very subjective history that was produced in that CDC book that I presented to all of you, was presented as the only interpretation of how smallpox was eradicated, and then pushed as a template for future eradication programs. And you see that very, very starkly in relation to the Global Polio Eradication Initiative. It is also not an accident that many ex-smallpox warriors, as they like to be called, joined the Polio Eradication Initiative. They also joined, a lot of them. So Bill Figge, very important figure in the Gates Foundation getting involved in polio eradication and other sort of, you know, global health issues. So these are not innocent histories. These are histories that are used to posit a certain standpoint of the world about how to work, sometimes quite undemocratic because it's a very bottom-down implementation vision of policy, which then, for example, initially gets embedded into the global polio eradication program. And I think we have to also remind ourselves that the Global Polio Eradication Initiative, to use the correct term, is way over budget and running really late. And one of the reasons the first phase really failed was because the artificial history of smallpox eradication was often justifying how to carry out work. And that was very exclusionary work without drawing in national workers, without listening to national workers, talking to a few brown and black chums, really, you know, people they would meet in clubs anyway, not really communicating, not only mobilizing communities. None of that was really happening till the polio campaign got a solid kicking on the backside, on the ground. And then when people started looking critically at some of these assumptions, then it was people like D. Henderson and Arita, who had been silenced, by the way, They'd been kept out largely of the polio eradication program because they were asking inconvenient questions about all these assumptions about smallpox eradication. And one of the saddest things I heard, DA once told me how in a major polio meeting, he got his invitation on the day of the meeting. Even the invitation, they couldn't not invite DA because he was such an important figure, but they could certainly time the arrival of the invitation to a meeting. And Arita Sensai also questioned some of the assumptions, and they were elbowed out. They were completely elbowed out. So there's politics involved in that. So some of these US CDC big heroes, who I'm sure wouldn't mind statues commemorated in their honor because their egos seem to be so big, have done very damaging things to global health. So where a democratic history could have been informed, could have helped informed more democratic engagement in global health, the egos seem to have got into the way, where they pushed some of the people who had pioneered these democratic ways of working in a major, the world's only human disease that has ever been eradicated, pushing those people out by saying, no, it's our history that matters. We will tell you, you listen to our historical interpretation. So in that sense, since the Gates Foundation is still here, those advisors for the Gates Foundation are still there. They're still the ex-smallpox warriors. In that way, things have changed, but some things haven't changed. There are similarities. And I'm sticking my head out here today because you're in Brown and you're in Harvard. They're not going to listen to anything anyone from Delhi University tells me. They won't even listen. They only listened to me when I was at University College London at the Wellcome Trust Center because they thought the Wellcome Trust was important. And now they won't agree with me, but maybe what I'm saying to all of you to join MIT, Harvard, and Brown event, maybe that'll exercise the brains a bit more, make them a bit more defensive, maybe, hopefully, act a bit more democratically than they have till now, because they're still at it. I mean, that last quote I gave you about that smallpox, management style case studies that will tell the world how it was done is a joke, is a complete joke. Till they work with historians who can pull out the names, the advice, the details of the brown and black actors who helped them. I tell Bill Figge, if he ever looks at this recording, why do you never mention Frank Grant, who taught you so much in Ghana? He never mentioned Frank Grant, even borrowed clothes from Frank Grant, because Frank Grant was as tall as him, and Bill Figge was very tall, and he certainly couldn't wear my clothes because I'm so short, but he could wear Frank Grant's clothes. So be democratic, be anti-racist, mention the Africans you learn from. Archives tell us that. That's why they don't like archive hounds like me, because I go in and I find this stuff, because some point accidentally a thank you message might have been sent between CDC officials and African Asian actors, where they actually acknowledge how much they're learning from brown and black actors. So historians have a role. I'm lucky, I'm privileged, I'm tenured, I'm not seeking to buttress my CV. I don't care if I get a Gates Foundation grant or not. I really don't care. Very happy to do my work with small bits of money that I can get locally. So this is it. This is how this world operates. So I wouldn't say that the WHO has changed that way. I mean, what you're talking about, maybe the WHO headquarters hasn't changed. These global forces still have tremendous influence, and these histories have tremendous influence.
No, thank you. That's a really important point. Sanjay, I want to make sure we get into the conversation, only because we have Professor Andy Foster, who is a professor of economics here and also on the steering committee of the Center for Contemporary South Asia, and also has some personal experience with the smallpox eradication campaign. So I turn it over to you, Andy.
Just to be clear, I'm a son of one of the CDC warriors, Dan Foster.
I met him. Yes.
Yes. Okay. Good. But the question I had is more academic. When you talk about democracy, it's sort of I find it a little startling, because I think, yes, the WHO did vote to do this, but from my perspective, the smallpox program really wasn't won very democratically. It was very coalitional, and I think that came across in your talk, right? You had different people, different groups who brought to bear different types of expertise, and that certainly was the case on the ground. The individual field workers all had knowledge about what worked and what didn't. And the successes of the program were in part the ability to work through that, to find the different skills and make them work together. And I think that was also one of D.A. Henderson's gifts. So I think there's sort of two ways of telling your story. One is there are a lot of people getting credit for stuff that other people did. And there's another story is there's a piece that each group was bringing. And in part, we may have left that out some of the other pieces, but what makes it work is all the pieces together. And I guess, and I think that really matters for when we think about today. Obviously, things are different. Expertise that was largely focused in CDC in 1970, not entirely, as you say, but certain types of expertise that were not in Bangladesh. Now some of that expertise is there, right? And so we have to think about things differently. The sort of areas of comparative advantage has shifted, but the idea that coalitions can be very useful strikes me as more on point than the idea that it's democratic per se, but perhaps I'm misunderstanding how you use that, how you're using that word.
No, I mean, very good point. I don't disagree with you at all. I mean, my point always has been to say that all the US CDC actors with their variations and attitudes were not unimportant. They were important, but they were important in very specific contexts. They did a lot of important work in the United States itself, convincing governments in the United States, the Johnson administration. An Indian couldn't have done that, a Bangladeshi couldn't have done that. US CDC did that. So that's one piece that you refer to. I have seen declassified government files where Figi, when he's in WHO headquarters, negotiating behind closed doors about intensification, things that should be happening, but also talking to African politicians and Asian politicians about other things too, which then intelligence reports pick up. He's not just talking about smallpox, he's also talking about wider negotiations. But those wider negotiations then make it possible for the then WHO headquarters to put the issue of intensification on the agenda, so to speak. So from that perspective, also very important, considering that Hafdan Mala was opposed to smallpox eradication. So they're important there, but they are not, in my opinion, as important on the ground as they've been made out to be. They've done some things, but they did things in partnership. Now, that brings me back to the second question Prerna asked, which I didn't answer, but it's connected to what you've just said, that those partnerships could be democratic in the sense that a brown person and a white person could talk as equals. That is what I mean by democracy. But believe me, I've seen enough confidential Indian paperwork to tell you how many races there were amongst the internationalists. So let's not pretend there was not racism. There was racism, okay? So that's what I mean by democracy. Racism showed up in many ways. Racism showed up by how one treated colleagues, which is what I spoke about, brown and black colleagues or brown colleagues in South Asia. But racism also sometimes showed up in how you treated those you wanted to vaccinate, how you vaccinated, how you used force, what your assumptions were. I don't need to tell you that, it happened across South Asia, Bangladesh, India. We've, I'm sure, both been regaled with stories of varieties of action. Now, to come back to Prerna's question and to connect that with what you've just said, which I agree with you completely, is I'm not romanticizing the Indian side either. I'm not romanticizing the Bangladeshi side either. I'm not romanticizing the West Pakistani side, the Pakistani side either. There's a lot of violence that used there as well. So just as there's variety amongst the internationalists. There are also varieties in the national groupings. And because there is variety in the national groupings, I once told my very dear friend Paul Greeno, who you may or may not have met, who's also written about smallpox eradication, when he wrote that very important first article about the use of force of intimidation during the smallpox eradication program in South Asia in social science and medicine, that he was actually romanticizing Indian involvement in that he was somehow, in my view, underplaying the fact that Indians were as involved in the violence, that violence that he spoke about. So, but there were those Indians and East Pakistanis, Bangladeshis who would say, no, let's not just go and kick in someone's door, flatten a woman and her 3 grandchildren and forcibly vaccinate them. Or let's not pull someone out from under a bed, kicking and screaming and forcibly, inject them with a vaccine. Let's go and talk to the matriarch of the village. Let's go and talk to the headman in the village. Let's try and, so what did Amaral and his group do very effectively? They would go, Amaral, I think, is to tease him, is the most vaccinated human being in the world, because he'd vaccinate himself 10 times in any village he went to so that he could convince everyone was safe, and then slowly bring people. It helped that he was Brazilian and football was loved a lot. Soccer in American parlance was loved a lot in India.
That's good for that purpose too.
Yeah. So I agree completely with you, Andrew. What I was trying to highlight is that ground experience matters and all sites are very complex. All of those distinct bits come together to have made what so many people thought was impossible possible. And I think it's amazing that smallpox was eradicated. I'm not one of those people who is against vertical programs, because for me, smallpox wasn't even a purely vertical program, at least when you study ground up studies. It was a vertical program that actually improved horizontal services. So from that perspective, both in Bangladesh, a lot of the smallpox warriors, as I'm sure Stan would have told you, went on to strengthen the primary healthcare movement in Bangladesh. So it's much more complex, but we can only get that complexity and the democracy of vision if we study it bottom up and stop studying it only top down. That is the point I was trying to make. But I was trying to provoke and apologize if that created upset.
So thank you. I have a bunch of questions and just comments, and I'm sure Andy can also, come right back into the conversation. But I did just want to encourage those of you who are still here, in case you have a question, please just put it in the chat or just feel free to raise your hand. And I'd be happy to kind of, we would all be happy to have you join the conversation. The one thing that I think I really appreciated your point that you made, Sanjoy, in response to Andy's point is I think the point about coercion being across not just international, but also kind of domestic actors and audiences. And so I think that, this to me becomes in some ways quite interesting when we're thinking about the kind of, again, just the implications for today. We know that coercion doesn't work. We know that coercion often backfires. We know that we don't want to be pulling people, out from inside their houses and forcibly vaccinating them. But as we kind of begin to think about kind of policy relevant insights from history, I'm just wondering what does work, right? Like we know that, first of all, I really appreciated your point that having artificial histories, artificially whitewashed histories of prior pandemics and prior vaccination campaigns being templates for future efforts to control viruses is the wrong way to do it. And perhaps we are, in a way, seeing the kind of results of that happening with smallpox, the racially exclusive history in the challenges that the polio eradication campaign has faced. But I'm just wondering, like, beyond that, so we don't do that. We try to write more racially inclusive histories, but within these racially inclusive histories, are there particular insights that you feel would be relevant today? So if coercion doesn't work, and we know that we are in the realm of persuasion, and I think you began to get at that when you said, well, maybe we get the matriarchs around the table. Do you feel as if there are some insights that in the process of writing and campaigning for a more racially inclusive history, you might be able to kind of bring to bear to the present moment? And, I invite other questions, but, if not, it might be a kind of good way to try to wrap things up as well.
Yeah, so again, excellent question, and thank you for that, Prerna. But I'd like to come back to, Andrew's very pertinent point. What is democracy? How am I defining democracy, right? I mean, as South Asians or people linked with the South Asia Center, I mean, possibly one of the most shameful episodes of Indian history, modern independent Indian history, happened 75 to 77, right? Emergency. So it can't be called democratic. So, and yet it created that autocratic impulse, that autocratic political movement in India, created space, greater space for those who wanted to use more violence in the smallpox eradication program or any health program to use more violence. And it is in this regard that we shouldn't forget, and I didn't mention it, so I'm as guilty doing that today, of about the forcible sterilization of young Muslim males who were identified as a problem for India's population problem at the time, who were, again, US actors were involved. Ford Foundation funded some of this work very generously, where young Muslim men would be dragged away, or not so young Muslim men later on when, the figures had to be massaged to look more impressive, and forcibly sterilized. And then when, there were smallpox surveillance campaigns and follow-up immunization campaigns, some of these people who had been involved in the sterilization campaign were also then drawn into the smallpox teams and they started approaching the same villages where some people had been sterilized. And villagers started running away, escaping, just melting into forests and melting, leaving the houses. There was wonderment. But people knew, So one of the things I keep saying, this fantasy, this technological fantasy that continues often, that you see that, everything will be okay. Let's just make a great vaccine and everything will be okay. Again, to come back to Andrew's point, the vaccine is a very important piece. The vaccine is very important. But the hand that holds the vaccine is also important. And if history teaches us anything, again and again and again, the archive, in practice, the hardest experience on the ground, what we are taught is that unless you have the right hands holding the vaccine, your immunization program isn't going to work. And therefore, investing not just in technology and a vaccine, but also investing in human resources, investing in community engagement, investing in long-term welfare programs that create trust, often is much more important than the best technology. Polio taught us that. A lot of resistance to polio eradication happened when, some of these people wearing wonderful clothes given to them by the Rotary, very colorful, very nice, turned up at someone's house who didn't have clothes to wear and said, I love you, I care about you, bring your child out, I'm going to put some drops in your child's mouth. And these guys would then say, you never cared for me in the past, I've not had water, I've not had electricity, I've not really eat one meal a day, why do you suddenly care for me? And there is suspicion. So, you have to show commitment to people's health and welfare over the long term to earn trust that can then become the goodwill capital that makes immunization campaigns work during pandemics or these vertical programs. And the other thing, my homage to Didier Fassa's work on how bodies remember. Bodies never forget. Bodies remember. Many of these matriarchs who resisted the polio immunizers were often the people who were also forcibly, violently vaccinated. And grandmothers are immense figures, as you and I know, but often the global actors don't realize how important mothers and especially grandmothers are in the family frameworks. So it's again, you know, who does the global policy representative engage? My dog has just arrived, so in case you hear a bark. Yeah, so I hope that answers your question.
Yeah, no, absolutely. And perhaps your dog's arrival should signal our ending. But this was, I mean, you know, this was a fascinating, absolutely fascinating talk. And thank you for being with us today. And thank you also for engaging with all our questions and our kind of, you know, pushback and perspectives. But thank you also for kind of leading this campaign for a racially inclusive history, which I think has ramifications, of course, far beyond smallpox, and to be honest, also far beyond public health. But thank you for joining us at the center. And as we always tell all our speakers who haven't been able to join us in person, we hope we'll be able to bring you here to Providence and introduce you to the delights of our small American town. But thank you again for being with us today. And thank you for all of us who joined, and to those many of you who I know will be watching this online at a later point in time.
Well, thank you for the invitation. And I joined all of you because I know that some of the people who manage some of the very important pieces, as Andrew put it, will listen to this because it was organized, this event was organized by you good folks. So thank you for organizing it, for having the courage to host me, because you might, and I'm grateful you're going to invite, you've invited me again. A lot of people don't want to see me again after I've spoken like this. So thank you very much.
Thank you so much. And we hope to see you in person at some point soon here in Providence.
Thank you so much. Be well, be safe, get vaccinated.
Thank you.